Welcome to the deep dive. Today, we're tackling a really interesting and pretty rare condition in dogs called glucagonoma.
hmm
We've gathered a bunch of medical literature, and, well, our aim is to really get under the skin of this condition, figure out what it is, what signs to watch for, and, what can actually be done about it.
Exactly. Think of this as us doing the legwork, sorting through the complex stuff to give you the key takeaways on this specific canine health challenge.
Okay, let's kick things off. So, glucagonoma.
Huh.
It's a tumor, right? But a very specific kind.
That's right. It grows in the pancreas, specifically in what are called the alpha cells.
Alpha cells, and their job is.
Their main job is producing the hormone glucagon, a pretty important hormone for metabolism.
Gotcha. And the problem with this tumor is
Yeah.
too much glucagon.
Way too much. Usually the tumor just goes into overdrive producing it. And interestingly, sometimes it might also churn out other hormones, things like gastrin, pancreatic polypeptide,
Right.
very rarely, even insulin.
So having all that extra glucagon floating around, I imagine that causes some serious problems systemically.
Oh, absolutely. It sets off a whole chain reaction, really messes with the dog's metabolism.
Wow.
Well, the body starts breaking down protein faster, that's catabolism, breaks down fat to lipolysis. The liver starts making more glucose, gluconeogenesis, and breaking down stored glycogen.
So it's like the body thinks it's starving, even when it isn't,
Yeah.
because of this faulty signal.
That's a great way to put it, yeah. The tumor's sending out this constant, we need energy and now W signal, so the body starts, cannibalizing its own resources. Protein, fat, releasing sugar.
Wow. That sounds like a recipe for major issues. What
Yeah.
are the big consequences we see?
You end up with a bunch of problems. High blood sugar is common, hyperglycemia, but also, critically, low levels of amino acids in the blood. That's hypoaminoacidemia.
Low amino acids.
Yeah.
Those are protein building blocks, right?
Mhm.
Why is that so important here?
Well, it's believed that this lack of amino acids is actually a key reason for the most characteristic sign of this disease, which we'll get to.
Okay. Any other consequences?
Yeah, you also often see anemia and significant weight loss that you can't easily explain.
And I think I read something about gut issues too.
Correct. The high glucagon can affect the small intestine, sometimes causing diarrhea. So, yeah, it really hits multiple systems: muscles, skin, hormones, digestion, liver, even potentially behavior.
Okay, that paints a picture of the internal chaos.
Yeah.
But what about outward signs? What might an owner or a vet actually see that makes them suspect this?
The big one, the real hallmark sign, is a very specific and frankly nasty skin disease. It's usually called necrolytic migratory erythema, NME for short.
NME. Are there other names for it? Sometimes medical terms get confusing.
Oh, definitely. You might see metabolic epidermal necrosis, which sort of describes what's happening at a cell level, or hepatocutaneous syndrome linking liver and skin, though the liver isn't always the primary issue in glucagonome itself. Maybe superficial necrolytic dermatitis, too.
Okay, NME is probably the easiest to remember. What does it actually look like?
Typically, you see redness, that's the erythema plus erosions, like worn-away spots and crusting.
And where does it usually show up?
It has a pretty characteristic pattern, often around areas where skin meets mucous membrane, so perineum, face, genitals. Also on the paws, the distal extremities, and very, very commonly, the foot pads.
The foot pads. Really, so a dog could just have bad feet,
Yeah.
essentially.
Exactly. Sometimes that's the main or even the only place you see it clearly. The foot pads get really thick, hyperkeratotic, crusty, often itchy and very painful. Makes walking miserable.
Ouch, poor dog. Any other signs beyond the skin?
Yeah, you might see other things. The dog might be lethargic, drinking and urinating more, polyuria and polydipsia. We mentioned diarrhea. Secondary skin infections, bacterial or yeast can jump on board because the skin's compromised. And that weight loss is often noticeable.
And it's mostly older dogs, he said, not cats.
Primarily older dogs, yes. And correct, no confirmed reports in cats that I'm aware of.
So an older dog with those specific crusty, eroded skin lesions, especially on the foot pads, glucagonoma needs to be on the vet's radar.
Absolutely. It should be a strong consideration. But, and this is important, it's rare. So you have to rule out more common things first.
Like what? What else could cause similar signs?
Well, general liver disease can sometimes cause similar skin issues, even without a specific tumor. And just having low amino acids for some other reason could potentially cause skin problems too.
Okay, makes sense.
Yeah.
And are there other skin diseases that might look like NME?
Definitely. Things like pemphigus foliaceus, which is an autoimmune disease, maybe systemic lupus, vasculitis, Even severe food allergies or certain nutritional deficiencies like zinc deficiency or a specific vitamin A issue, lots to rule out.
Right. And you mentioned earlier that glucagon levels themselves could be a bit tricky. Like
Yeah.
slightly high levels don't automatically mean glucagonoma.
Exactly. That's a key point. You can see mild increases in glucagon with other problems, liver disease again, other pancreatic issues, kidney failure, even severe infections, diabetes complications like DKA or Cushing's disease. So you need really high levels usually, along with the clinical signs, especially the NME.
Okay, so diagnosis sounds like putting pieces together. What tests do vets actually run?
You start with the basics usually. Blood count, chemistry panel, urinalysis.
And what do those typically show?
Interestingly, they might be surprisingly normal sometimes. Or you might see subtle things. Mild anemia, maybe high neutrophils, slight bumps in liver enzymes or bilirubin, maybe slightly high blood sugar, low albumin. Liver function tests like bile acids are often normal though. Urine might be dilute, and if they've developed secondary diabetes, you'll see glucose in the urine.
Then you move on to the more specific stuff, like measuring glucagon.
Precisely. You measure plasma glucagon levels. In classic glucagonoma, they're usually sky high, like over 1,000 picograms per milliliter often. But again, a normal or only slightly high level doesn't 100% rule it out, though it makes it less likely.
What about those amino acids and zinc levels you mentioned contributing to the skin problems? Do you test for those?
Yes, definitely helpful. Plasma amino acids are usually significantly low, and that finding really supports the diagnosis if you also have the skin lesions and high glucagon. Zinc levels are often low too, and that adds another piece to the puzzle. We might also check fructosamine to see if there's evidence of chronic high blood sugar, indicating secondary diabetes.
And can you actually see the tumor with imaging?
Ultrasound is the go-to. It's pretty good at finding masses in the pancreas or seeing if it's spread nearby or to the liver metastases.
So ultrasound is key. Any other imaging?
In human medicine, they use more advanced stuff like CT, MRI, PET scans, even special scans looking for hormone receptors to get a better look. Those aren't as common yet in vet med for this specific condition, but ultrasound is very useful.
Okay, so it sounds like a definitive diagnosis really needs, well, multiple confirmations.
Absolutely. You need that combination. The clinical signs, especially the NME skin lesions, the very high glucagon level, and then ideally confirmation with biopsies.
Biopsies of what?
Of the skin to show that characteristic microscopic pattern. Pathologists sometimes call it red, white, and blue. And if possible, a biopsy of the pancreatic mass itself. That tissue then needs to be stained, especially immunohistochemistry, to prove it's actually making glucagon. Often they test for other hormones too.
Right, putting all that evidence together. So let's say you get the diagnosis confirmed. What are the treatment options?
Okay. Treatment. The absolute best shot at a cure is surgery removing the primary tumor, assuming it hasn't spread.
But I sense a but coming.
Yeah, there's a significant but. Surgery for this in dogs carries a pretty high risk of complications, even death, unfortunately. It's not a simple procedure in these cases.
Why is it so risky?
Well, in people with glucagonoma, there's a known increased risk of blood clots, thromboembolism. This makes any surgery much trickier. It's thought something similar might be happening in dogs, contributing to the poor surgical outcomes we sometimes see.
Okay, so surgery is ideal but risky. What if it's not an option? Or the owner decides against it?
Then you look at other approaches. Sometimes what's called debulking surgery, removing most of the tumor and any visible spread combined with a drug called octreotide, can lead to temporary improvement, especially in the skin lesions.
Octreotide. We'll come back to that. What if even that isn't possible? Purely palliative care.
Right. If surgery or octreotide aren't on the table, you focus on managing symptoms and maintaining quality of life. This often involves diet, specifically a high-protein diet.
High protein, like extra meat.
Yeah, and sometimes specifically adding egg whites is recommended. Like for a medium-sized dog, maybe 2 to 4 egg whites a day. Zinc supplements can also help the skin, even if blood levels weren't low initially. Fatty acids might be beneficial too. And crucially, treating any secondary skin infections aggressively.
Okay, let's talk meds. You mentioned octreotide. What does it do?
Octreotide is basically a synthetic version of a natural hormone, somatostatin. It acts like a brake on hormone production, including glucagon, so it helps lower the levels coming from the tumor.
And when is it used?
Mostly when surgery isn't possible, either because the tumor can't be removed or it's already spread. It doesn't cure it, but it can help manage the effects of the excess glucagon.
Are there side effects?
In humans, things like pain at the injection site, sometimes tummy upset, gallbladder issues, The exact dose in dogs is still kind of being worked out, but some studies suggest doses given under the skin a couple of times a day.
What about chemotherapy? Is that used?
It's used in people with some limited success using drugs like doxorubicin or streptozotocin. Streptozotocin has been used in dogs for insulin-producing pancreatic tumors, but not really widely reported for glucagonomas specifically.
And what about steroids like glucocorticoids? They help itchy skin, right?
They can, yes, but they're generally a bad idea here.
Why is that?
Because steroids raise blood sugar, and since these dogs often have high blood sugar already or even full-blown secondary diabetes due to the glucagon, steroids can make that much, much worse. So usually best avoided.
Ah, right. Good point about interactions. You also mentioned intravenous amino acids earlier.
Yes, giving amino acid infusions directly into the vein has shown some variable improvement in the skin lesions in some dogs. It's thought to help replenish those low levels we talked about. If it helps, the infusions might need to be repeated, maybe every week or two.
And for the skin itself, any topical treatments.
Yeah, things to help manage the crusts and discomfort. Medicated shampoos with sulfur or salicylic acid can help soften things up, even just very gentle shampoos. The goal is to soothe the skin, reduce pain and itching, especially on those sore foot pads. And oral zinc supplements, as we mentioned, are often part of the plan too.
So it really sounds like a combination approach is often needed. Managing the hormones, supporting nutrition, treating the skin.
Absolutely. It's rarely just one thing. And you always have to consider how treatments might interact, like that steroid and blood sugar issue.
After treatment starts, what kind of follow-up is needed?
If the dog had surgery, you'll definitely be doing follow-up blood work to see if the glucagon levels are coming down and staying down, and if other things like anemia or low albumin are improving.
And checking for spread.
Yes, regardless of the treatment, regular monitoring for metastasis is really important. That usually means periodic abdominal ultrasounds and chest x-rays to look for any signs of the tumor returning or spreading elsewhere.
Okay, so let's try and wrap this up. We've covered a lot of ground on canine glucagonoma. It's this rare pancreatic alpha cell tumor,
Right, pumping out way too much glucagon.
which leads to all sorts of metabolic chaos like high blood sugar, low amino acids,
Weight loss, anemia.
and that really characteristic skin sign, NME, especially affecting areas like the foot pads.
Exactly. That's often the biggest clue.
Diagnosis involves ruling out other conditions, checking for super high glucagon levels, and usually confirming with biopsies.
Yep. Putting all those pieces together.
And treatment. Well, it's complex. Surgery is the ideal goal, but risky. Other options like octreotide, dietary management, and treating the skin are often key parts of the plan.
It's definitely challenging, but there are ways to manage it and focus on the dog's quality of life.
So while it's rare, it's something vets need to keep in mind when they see those specific skin signs in an older dog.
Definitely worth considering in the right context.
And it's encouraging that even if a cure isn't possible, there are strategies to help these dogs feel better.
Absolutely. And thinking about it, the link between this tiny pancreatic tumor and such dramatic skin changes, it really highlights how interconnected everything in the body is.
Yeah, it makes you think, doesn't it? How internal problems can show up in really unexpected ways on the outside. Like, what other seemingly weird signs might actually be pointing to something specific going on deep inside?
Exactly. It's a good reminder to always look beyond the obvious symptom.